Good evening, Dr. Sunil.
Good evening.
Welcome.
Thank you.
Uh, really nice to have you on our show. So, friends, it's really interesting to have someone who's a very accomplished person. So, let me just give you a little brief about Dr. Sunil. Dr. Sunil is an accomplished endotonist and an experienced sportsman and fitness sports skills coach. He conducts workshops and classes for children, adults, and seniors, and he's a Golden Hearts fitness classes. He also has a Golden Hearts fitness class for senior citizens at Chembur. So,
Yeah.
welcome, Dr. Sunil, once again.
Thank you so much, Meena. And let me wish all the viewers um, the very best. And let me share my experience in sports and in fitness for the benefit of all. I'll do my best. I'll try to
Yeah,
do my best.
thank you so much. Yeah. So here, Doctor, see what we've been noticing. In the it's just like a pattern that's been happening all around. Youngsters are getting heart attacks. And most often, after they are hitting the gym. So while they are in the gym, it happens, and suddenly they're just taken to the hospital and they're proclaimed dead. What is it that makes them go way this way in the gym when they're all very healthy human beings and they're much below the age of 50, and so what is the reason why we're finding it? So it's been many people like Puneet Rajkumar. There have been people like Siddhant Suryavanshi, and so many such people who have just fallen off. Yeah.
Yeah. Okay. So, this is a very valid topic, and I think it needs to be brought to the attention of a lot of people all around. Um, let me start by just saying that when you exercise, we're talking about gymming. So gymming is a form of exercise, and when you're exercising, you're not really doing some leisurely activity. You are straining your body. So when you strain your body or you exert your body, you need to be aware of all the factors that are going to act up when you are gymming or when you're exercising. So even whether you're young or old, it really doesn't matter. It's just that you need to be within your limits when you're exercising. And you've got to respect your own body and you have to know the limits. So let me, in a very simple manner, try to explain this factor. When somebody goes to the gym, I would say before he or she goes to the gym, he needs to go and get a medical clearance done from his doctor
Yes.
by informing the doctor of all the risk factors that he or she has. It could be something like genetic hereditary factors. If someone has had a heart attack in the family before, that becomes a risk factor for that person who now wants to go to the gym. His age is important, whether he's got high blood pressure, diabetes, does he smoke, does he drink, does he have stress of any kind. Now these are basic stress risk factors which have to be told not only to the doctor but also to your trainer when you go to the gym. If your doctor gives you the clearance to go to the gym after doing certain tests or putting you on certain medications, you go to the gym, but inform your trainer that you have these problems which are being attended to and you're following those advices. So that's one factor. Now you go to the gym, you're under guidance of a trainer, you start your workouts, but again, you've got to be within limits because your body is going to come under a particular strain. If you're a newcomer, it's more valid that you're careful. If you're a regular, you know certain things. But let me talk about people who are newcomers and go to a gym because that's where the problems arise. Even for the regulars, I'll come to that. But the newcomers need to uh, know what these are basic things. Okay, if your viewers are listening, I think they should understand this factor that your pulse rate, your resting pulse rate is a very important factor that you should know how fast your heart beats in normal circumstances, because when you go to the gym you're naturally straining your heart, so the heart is going to work much more than it is used to. So if it's not capable of handling that exertion, it is going to give you trouble. It is going to either stop because of lack of blood supply coming to it, and that causes a problem. So know your limits. There's something called target heart rate, which is specific for every person. Anyone going to the gym has to know what his target heart rate is. Now, that if I had the time, I could explain to you how to do it, but if you need me to, I will later on. So, your
Yeah.
target heart rates need to be known. All your workouts, all your exercises have to be done within your target heart rate. If you go beyond your target heart rate, you are exerting your heart too much. The heart may not be able to take that load, and it tends to stop working. That's because the demands when you're exercising are on your muscles, which require a lot of oxygen. So that oxygen is pumped by the blood coming through the heart, from the heart. So if the heart cannot take that load, it naturally will stop working, because it can get blocked due to any reason. You can have two simple reasons for heart attacks. Let me give this very clearly. The first reason for a heart attack to happen is that you could have a hereditary problem, like some arrhythmias, rhythm of your heart, the beat is not
Yeah.
regular. So it can be an arrhythmia, it could be a fibrillation. So these kind of things cause electrical disturbances in the heart, and the heart can stop working when it is exerted beyond your conditioning. If your heart is not conditioned to that kind of workout, it will stop because of disturbances. That's one. And the second reason, which is more common, is that when the heart starts beating very fast and it's not used to it, it could dislodge something called a plaque. A plaque is nothing but a kind of a clot, a small fibrin clot, which is released from the wall of your artery,
Mm.
and it just flows and gets stuck somewhere in the artery which is supplying the heart. So, in other words, the blood supply to the heart is being either narrowed, slowed down, or if it's a complete block, it completely blocks the heart and the heart just stops. So, when it stops, it's called a cardiac arrest. And when it is partially blocked, it's called an infarct. So,
Yeah.
basically, what is happening is that your heart is not getting enough blood to supply the muscles of the body when you are exercising.
Yeah.
So that's the reason you have to be within the target heart rates to not overdo anything like that. So, in short, these are the two reasons why it happens.
Yeah. Something that Satya says is quite true. He says, I feel nowadays people view going to the gym as a symbol of being cool, hence, they tend to push themselves beyond their natural capabilities. Therefore, so many deaths related to gym. And then he continues with another one saying, also the kind of image created about the perfect body by the movies is another major factor. People want to achieve the kind of body that a particular actor has within a short duration.
Absolutely. This is a brilliant analysis which a lot of people don't understand. See, I've been in the sports industry and in fitness for a long time, and I respect this factor very much. Now, what Satya said is really true. Let me put this in a very simple way again. Every body is unique. Do not try to do things that somebody else is doing, because your body is not going to react in the same way. First. Second thing is, fitness is not about looks. Fitness is about what your body can do to maximum efficiency at any given time, at any given age. So, what you need to strive for is efficiency in doing things, not in building muscles, because muscular people are not fit people. Let me be very clear about this. If you're thin, it doesn't mean you're not fit. If you're obese, or I would say if you're on the little fatter side, it doesn't mean that you're not fit. It is all about what you can do with that weight of yours. So, if you can put that weight to good use by doing certain regular physical activities, that is good enough. And how you look is how you look from within yourself. The external appearance is just a short term gain. Don't ever go for shortcuts to achieve fitness. It's a journey. It has to be a passion. It's got to be an obsession. Like for me as a dentist, actually, I'm an endodontist, so I do root canals. But if I have to compare the profession of dentistry with fitness, I'll say the way you brush your teeth without fail every morning, The same way, if you can put half an hour to 45 minutes of regular physical activity 5 times a week for 1 hour every day, that is getting you to be a decent, fit person. You don't strive for muscles and, six pack abs and, looking like how your neighbor looks.
Yeah.
Please don't get into those kind of things. So you are your boss. You think on your own. That's
Yeah.
the way it is. Satya, you're absolutely right when you said
Yeah.
that.
And what we've also noticed is that people who lose weight, in a very short, brief period, their skin starts sagging because all the fat goes away, and then suddenly their stomach is sagging, their armpit, everything is sagging. So that itself should, put you in the right path, saying that you should lose weight slowly and intelligently. Now, many
Absolutely.
of these people are saying that do you think that the vaccine has had any effect on it? For example, United States of America says myocarditis. After exerting more heartbeat, the chemical doping for heart attack is more in vaccine patients. And Priya says, is there any truth that vaccines, COVID, is leading to heart attack?
Okay, so let me first clarify that I'm not an expert on vaccines and things like that, but through pure common sense and if you just logically understand what's happening with COVID over the years, I mean I've followed it for the last 3 years. There is a possibility that there could be some adverse changes happening to people who have had COVID on their heart. I mean, there could be a problem of thickening of the arteries, which adds to the chances of an attack or an infarct. And also, the megalopathy is an important factor. It the possibly certain viruses do cause changes in the muscle of the heart, the thickening of the muscle. Whenever the heart muscle changes in either thickness or shape, the efficiency of the heart could reduce because the contraction of the heart is based on its flexibility. So if the heart muscle gets thick, naturally the flexibility reduces. So the pumping efficiency of the heart to release blood in sufficient quantities reduces. We call that the cardiac output from the heart into the muscles when you exercise. So that efficiency reduces. Now, if this efficiency reduces, naturally the load on the heart becomes more when you exercise vigorously. So it could cause a problem in these cases. But all said and done, these are still probably being analyzed and people are doing the research on it. But it is something that you should be a little careful about. If you have had COVID, I would say go slow in the gym and look at how your body and your muscles are reacting to your exercising. If you feel you're just the way you were before you had COVID, you may be fine. But even then, be very conservative, be smart, and don't get carried away by anything around you. So it's just how you tackle that thing. Be careful. That's it.
Yeah. So Maya says, so should youth be educated that getting a six pack doesn't mean a sign of perfect health? In other words, perfect sculpted body is not equal to perfect health. And she continues, does media play a role in pushing the idea of ideal body type, leading the youth to a quick fix with accompanying side effects?
Absolutely, we are so carried away by what we see and how it appears, even though it's fake. With all the photoshopping and all that, you can change faces. Suddenly an actor, you see him today how he is, and tomorrow on screen he's got 8 packs. I mean, see, even if he has 8 packs, you'll notice that most of these guys after that movie they are back to where they were.
Yeah.
So see, whenever you look at fitness, please don't look at it as a short term arrangement. Look at it as a lifelong obsession where you just want to look good and you want to be efficient in your daily routine. That is the
Yeah.
exact meaning of fitness. It
Yeah.
has nothing to do with six packs, how you look, how sculpted your body is. That's a very short term kind of outlook that people have. So look at what you want from the long term. Just work on it slowly, steadily. I'll give you one piece of advice to all those who are listening. In there are three terms which should be with us for our lifetime, and it's right now it's doing the rounds. We all talk about balance. See, balance in life, in everything, is good. We all agree to that. So balance, regularity, and intensity, these are three words. If you remember and you work towards, you will always find yourself on good ground. You balance in everything you do, don't overdo anything. Regularity with all the good habits that you want to cultivate, because that adds to the positive things that will happen in your life. And the intensity part is important, because if you do not step up the intensity gradually, the benefits that you're going to get might stagnate. You will
Yeah.
stagnate at a point and not grow. See, in your job, in anything, if you do not gradually, smartly increase the intensity of what you're doing, you will not grow. So the same works with your body, your mind, your exercise. Once you're comfortable in a particular zone, you must raise the level of your thing gradually. Now that's crucial. You can't jump 10 steps up. You have to go step by step by step, and acclimatize at every step. You can't climb Mount Everest in one shot. So you go to base camp, then you go to level 1, level 2, level 3, then up. That's the way you've got to work with exercise as well. Okay. Yeah.
Yeah. So Martin and a few others are asking, what about brisk walking and yoga? So more people are asking you the same question is, sir, do you think walking is the best exercise as one grows older?
Absolutely, you're right. And when you use the word brisk walking, you're further right. See, here's where, and I'm going to give you a tip, which all of you, whoever walks, is going to really, if you take this up seriously, you'll see the benefit of what happens. Okay, the first thing I want to tell you people is that check your pulse, and please make a note of your resting heart rate. All of you, if you can't do it, tell your doctor to measure your pulse and give you your resting heart rate. That is going to be the basis of everything you do later on. Exercise and your workouts, your running, walking, gymming, whatever. So once you know your resting heart rate, now let me see, there are two things that are going to matter: the regularity of your walking and the intensity of your walking. Now, how do you do this? You wear a wristwatch so that you know the time that you're going to start your walk. Then you decide before you start walking as to how much you want to walk. Say, I'm going to take 10 rounds of a particular ground. So you look at your watch, start walking those 10 rounds, note the time when you finish your 10 rounds. So you know that I finished it in this much time. Now continue doing that for a month. At this, don't try to do it in less time for a month. Just do it for a month in that same time. Next time, after a month, when you're settled with that time, either you increase the distance by one round more, or you try to walk a little faster to
Mhm.
shorten the time taken for 10 rounds.
Yeah.
So increasing the distance or reducing the time will add the intensity to your workout in a gradual manner. Then you stabilize at that new time or distance for the next 1 month. When you're settled there, you further make it 12 rounds instead of 11 rounds. That's the way your heart gets better, because it won't stagnate. You're pushing it further and further, but slowly.
Yeah.
So this is the way you should exercise. So plan your workout, plan your walk. Don't walk just for the sake of walking. Walk with a purpose. You have to have a purpose when you walk. Enjoy the walk, but walk with a purpose, and that helps you. Now what you will find after 1 year, when you check your heart rate, you will find your heart rate, resting heart rate, has dropped by 1 or 2 points. If it was 80, that heart rate will come down to 78 or 79. Why?
Yeah.
Because in that 1 year, your heart has improved. The pumping efficiency of your heart has improved. So that's what you want with exercise. That's the reason we exercise. It's not
Yeah.
just because my neighbor does it.
Yeah. So one of the doctors was saying that, see, even better for your knees is that you try to walk backwards. as much as you can.
Yes, you there are various variations. See, as you age, it's great to not, as I said, balance is an important part. So apart from balance, there's something called coordination. So if you want to improve your balance, coordination, your peripheral vision, so that you don't fall, all those kind of things, there is just to have some fun when you're exercising and doesn't get monotonous. You should bring in these variations like walking backwards, walking sideways, jogging a little bit between your walks. See, this makes a difference. Like if I'm just walking, and say my knees are bad and I don't like to run, I can at least say jog 3 steps. Now, when I do that little change in walking, jogging, walking, jogging, it is increasing and decreasing my heart rate a little bit. So it's adding that variation to the heart, and it is allowing the heart to make those changes within itself, so that it is getting used to these kind of things. It doesn't become a monotonous one way thing which you don't enjoy and you're doing it just for the heck of it. So make these variations. Walking backwards is good for coordination, good for peripheral vision, good for as you age, because your brain works better. So
Yeah.
it's a brilliant thing to do.
People have a problem with pedometers. They say that, see, some pedometers, even though you walk double the distance, they count only half the, feet, number of steps that you take. So
Yeah.
how do people tackle that?
See, don't worry. Frankly, if you ask me, don't worry too much about how many steps and all you're
Yeah.
doing. Just the regularity of what you do is going to be important. You enjoy your walk, you enjoy your run, your jog, your cycling, your swimming. All these are exercises. So whatever you do, don't worry so much about the I would say technical part of your monitoring it in that way. Just do it with interest and enjoy it, because see, after all, gadgets are never going to be perfect.
Yeah.
We, according to me, your marker should be your pulse.
Yeah.
Your pulse is right in front of you every time you walk. So all you do is put your thumb on your radial artery, that's here. If you can,
Yeah.
if I can just show
Yeah.
you that.
The other way.
Right,
Yeah. Yeah. Yeah.
this is my thumb.
Yeah.
If I
Yeah.
just put my finger here, right here,
Yes. Yeah.
and just touch this, I will get a pulse.
Yeah.
I'll get a beat.
Yeah.
So very lightly, don't press it hard. We just keep
Yeah.
it here alongside the thumb down,
Yeah.
and
Yeah.
you'll get a pulse. You'll get a beat. So that if you count it for 1 minute, you will get your pulse. You don't even need your doctor to do that for you.
Yeah.
So
Yeah.
and that is your pedometer. Let me tell you that. Forget all pedometers. Your pedometer is going to be you. So that's all you do. It's
Yeah.
and the other thing is, with older people, since I work a lot with older people, there is nothing like age. Age should not limit you to do things. Uh, I mean, I want to be modest on this, but I have to tell you this. I play badminton at very high level. I'm still playing it in international tournaments, and I play with youngsters who are 20 years and 25 years also. So, what I'm trying to say is that don't bother that because you're that old, I can't do something.
How old are
You
you, doctor?
I'm 63 now. So I play tournaments. I play all kinds of sports:
Great.
cricket, hockey, badminton. I mean, athletics. So anyway, but I do that because I've been very regular with it. Even in spite of my practice, I've never given up my sports, and I take
I
time
guess
out.
your eating habits also must be equally good.
Yes. So with eating, this is another tip I'm giving you people. Never eat to your capacity. Okay, when you eat, like how the Japanese eat to about 80% of your capacity. Never eat beyond 80%. Never fill your stomach. uh, you have to keep space in your stomach and eat 5 meals in a day, 5 small meals in a day. No one meal should
Ending
be.
at what time?
Yeah, you can eat. See, you have a breakfast. You can have something at 11 o'clock. So your lunch at 1:30, something at 4 o'clock, and one at 8 o'clock, and that's done. Now, what that does is it doesn't allow acidity to set in
Oh, yeah.
your stomach, and you don't overeat at any one particular meal.
Yeah.
The larger the
True.
gap you give, the more the chances of you overeating in one particular meal. So even if you have a fruit, the fruit acts like a full meal, and there is a
Yeah.
digestive process going on, so you
Mm.
don't really feel that hungry when you eat. The other tip is you can drink a glass of water half an hour before, or maybe 20 minutes before you have a meal, so that that will cut down the space available in your stomach for food to fill
Yeah.
in. So these are small things which make large differences in your entire body. So eat
Yeah.
less. Quantity of food is just as important as quality of food.
Yeah.
Okay, so remember that.
Yeah. Modi E is asking you. My father is a bodybuilder from the 70s. He's completely against working out in AC with loud music, calorie counting, and expensive shoes. He says, learn to listen to your body than to some YouTube music.
Absolutely. I mean, I agree with that. Sometimes, we just because these gyms want to be commercial, you'll find them playing all sorts of loud music. It's quite disturbing to certain people. Now, the youngsters like it, so, you may not be able to say much, but that's fine. You do, I mean, you can put your earphones on, or you put ear plugs if you want, and just go and do your bit and get out of the gym. Do not
Yeah.
bother about all the distractions that are going to happen. There are certain things you may not be able to control, even in
Yeah.
gyms.
Yes.
So you put earplugs. I mean, I would do that,
Yeah.
and just go and do your workout and get out of the gym. And remember to do your warm ups and your cool downs, because
Yeah.
now, when you're in a gym, there are certain rules that you have to undertake. One is you have to warm up a little bit before you start your workout. One. Secondly, keep hydrating yourself in between. Keep having a sips of water in between. And after you finish, you cool down a little. Cool down is basically a little stretching and things
Yeah.
like that to be done. You must stretch a little bit. Also, keep a watch on how your body is reacting. There are things like, I'll tell you, things like, see, there's a difference between pain, there's a difference between exhaustion and discomfort.
Yeah.
It's good to have a little discomfort, but you should never get exhausted when you're
Ah.
working out, because that's not good for your body.
Yeah.
Discomfort is good because that's where the growth occurs, in the
Yeah.
body. Also, immediately stop if you have excessive sweating, if you have pain in the shoulder, chest, back, jaws. These are very important things. If your breathing is affected, if you can't breathe, you're having difficulty in breathing, if you feel giddy, if you're feeling nausea, if you feel little vomiting, these are times when you immediately realize that something is not right, and don't continue.
Yeah.
Stop. Tell someone, go to the doctor, things like that. Also, see that your gym has enough medical facilities. You must have something like a CPR trainer there. So there must be someone who can do a CPR. And
Yeah.
secondly, you need something called an AED. It's called an automated external defibrillator. Every gym has to have an automated external defibrillator, which is very useful if you immediately have an attack of any kind.
Yeah.
And as I said, you need a CPR certified person. If these two things are not in a gym, don't go to that gym.
Yeah. Priya is asking, is it useful to walk wearing magnetic chappals?
Frankly, I'm not too aware of magnetic chappals. I don't know in which great way they are going to help you. But I mean, you can figure that out. Talk to someone who knows more about magnetic chappals.
Yeah.
I don't really know how they will help you. So you can educate me on that. I really
Yeah.
won't. Yeah,
Moon is
thanks.
asking you, sir, should men do cardio exercises after 40? If yes, then how much is healthy? Also, are protein supplements healthy? Now, here there's an additional question from somebody else. Martin also asks about protein supplements because a lot of the people believe that in these shakes, protein shakes, they add something which could be bad for your body.
Okay, first thing is, should men do cardio exercise after 40? Absolutely. I'll tell you one thing. As you age, you have to exercise more than what you were doing before. See, remember one simple thing, that as you age, there are, physiologically, your body is degenerating. As you age, it's natural. Your muscles will degenerate, everything gets less. Now, if you don't counter that by doing something to improve it, the deterioration is going to be much faster. Okay. So, to counter aging, one of the most important things is to exercise more. You have to have more physical activity, more mental activity. It should not become less, it has to become more. So 40 plus is nothing. 40 plus, you can do a hell of a lot of things. You can climb Mount Everest 5 times if you want to, because all that requires a, cardio. So you have to do cardio exercises, one. Okay, second thing is, how much is
Protein
healthy.
supplements.
Yeah, and you can do it regularly. As I said, 5 days a week, 1 hour every day, cardio. Of course, cardio with other strength exercises, not only cardio. So you can break up cardio thrice a week or twice a week. Now, as far as proteins supplements go, this is a topic I'm very much against. People taking supplements. Frankly, let me tell you, your body requirements are very clear. Your body is in a balanced state the way it is. How much you eat is distributed within proteins, fats, and carbohydrates. Now, generally, let me give you a guideline. Protein in our body is required to the tune of zero point 0.6 grams per kilogram of body weight. So, if you are 75 kilos, you will require about 60 grams of protein every day. That's it. Okay, as a normal individual who is not exercising regularly. Now, if you start exercising, what happens is the requirement of protein may go a little more. Now, that little more requirement for growth of your body and for repair of your muscles is required, but you should get that from increasing dietary protein. Please understand this. You have enough protein in diets which you can take and use it to build your body when you exercise. Now, if you take supplementary protein, my problem with supplementary protein like whey and there are others, is that many of them contain a lot of sugar. Now, when you take these proteins supplements with either powder or liquids, fluids, you will be probably taking more sugar than required. So, what happens is your sugar levels go up, you don't get proper sleep, your body weight increases, your fat content, body weight will increase, your acidity levels will increase, and these are issues. They could create problem. And because that protein is not really required for you for that much workout, the excess protein that you're taking, your body needs to digest it and excrete it. So your liver and your liver and your kidneys are going to be hurt, they are going to be overworked, and you will damage your liver and your kidneys if you take protein which is not required for your body. So, what does supplement mean? Supplement means just taking what you don't have in your body, just that much. Supplement does not mean adding
Yeah,
unlimited
much
amounts
more.
of something.
Yeah,
So please understand that what is required is taken. Excess is bad,
yeah,
and most protein supplements have sugar. If you want to take a small supplement, check and see that it doesn't have sugar.
yeah,
So the isolates, there are whey isolates, protein isolates, they may be better. So that you check, but no sugar should be in your proteins.
yeah,
Otherwise, take it from natural means. You have lentils, seeds. You can have egg white, you can have milk, you can have all that. You can have chicken, turkey, whatever. But
yeah,
don't take. I would not recommend protein supplements at all. I mean, I'm
yeah,
not one for that.
yeah. Maya is asking, in old age, most problematic is having a fall. What exercises would help prevent falling, especially in the bathroom?
Brilliant. Now, this is my specialty. So let me be clear about this. I'm the only person um, who takes classes exclusively for senior citizens in this particular problem. Now, why, it's very important to understand why people fall as they age. The reason they fall for two reasons. One is because the strength in their muscles reduces, their joint flexibility reduces, they cannot bend their joints the way they used to, but that is because the muscle strength reduces. Then the confidence reduces because the strength reduces. They feel they can't do certain things, like even climbing stairs or walking on a road or crossing a road becomes difficult, so this is all because it's more mental. It's to do with lack of certain activities which should have been done continuously, which have stopped now. So, what we do in our Golden Hearts program is to build strength in the muscles of the body, build their movements, all their range of movement. Means if this is my elbow, I mean, let me just show you this. If this is my elbow, I should be able to bend it completely and open it, bend it now this is the range of movement. This is the range of movement here, and then I open it fully. So all joints of your body should be able to open and close or rotate, or whatever they are capable of doing, they should be able to do at any age. It may be slower, but you have to keep it going. So we do that in Golden Arts. Then what we do is we simulate difficult conditions like bad roads, different surfaces to walk on. We make them walk on hard, soft, through certain potholes, and we teach them to maintain their balance. We teach them what center of gravity is, how your body should be positioned, how you should sit, how you should stand, how you should walk, how you should be in control of your body. Your body should not tilt. So because your center of gravity changes, if I tilt, I am in this position or this position, and then naturally the load on certain parts is more. So my muscles cannot take that load on one side, and I collapse, I fall. So, it's all to do with mechanics. The body is a mechanical structure, so you have to respect it, and you have to just do what is required. You don't I mean, these are things which some people, I have taken it upon me to train the older people, because I know 40% of elders fall in their lifetime. 40 to 50% of elders suffer a fall. Many times the fall is so bad that it is a debilitating fall. Some people die because of a fall. Like she mentioned the bathroom, which is absolutely right. You can slip in a bathroom and you can hit your head at the back, and that could cause serious damage. So
Fatal.
this is exactly an important part, that be aware of where you are. See that your bathroom floor is not wet. Put a railing in your bathroom so that
Yeah,
the elderly
absolutely.
can flow. So all these kind of things,
Yeah,
it
yeah,
is important. So we do
yeah,
that balance
yeah.
thing.
Divided Streets of America says how to reduce blood pressure.
Okay, now see, blood pressure reduction, a lot of it has to do with your doctor. He will examine you, find the reason for your blood pressure. It can be due to many reasons. So he is going to prescribe medicines and things like that. But if you want to do something the natural way, one thing, as I said, is exercise, but it has to be a very planned exercise, like the walk that I told you, which has to be planned, slow and steady and regular walking, noting down the time, increasing the intensity, all that. So walking will eventually, it will reduce your blood pressure if you strain your heart in a very planned manner. And the other ways are reducing your weight, all your habits. Your sleep pattern has to be good. um, Good habits like early sleeping, early rising, eating less. I mean, these are basic things. Controlling stress, these are the only ways you can really reduce blood pressure. Your diabetes has to be under control. So see, if you ask me a single factor that is good for fitness, single, we all know that you have diet and exercise and rest and all that, but the single important factor according to me is exercise.
Yeah.
After
So,
years and
doctor,
years,
yeah.
I've told.
So, doctor, what happens is as people age, the tendency is to sit more than to walk about. And without your realizing it, you spend more and more time on your sofa than, actually walking or doing something. So, after a certain stage, it becomes difficult. So, how do you tell elders that don't sit for too long. You need to, walk in between, or you need to use your muscles more.
I think somebody in the family has to take that initiative and, be after the elders. See, this is the reason I started Golden Arts, because somehow or the other, the older people are always the neglected lot in a lot of things. We have activities for the whole world, but then we don't look
Comes
at,
to elders, it's not.
when it comes to elders, we always take them for granted.
Mhm.
But the elders have a lot of potential in all respects,
Yeah.
frankly. I mean, I have seen changes of, just magic happening in people with grave illnesses like strokes and all. And people, I had a person who was a stroke patient, and in Golden Hearts, we worked on him for about, I think, what, a year. And now, he was kicking a football, a running football. He could run and kick a football in the studio where we were playing. I mean, it was just fantastic to see. So what I'm saying is, get some motivation into the family, get that senior to, you can show him some videos of things happening, and just motivate him and get him to do just little work. It has to start from a small walk in the house. Just get up, walk in the house, sit, do some exercises on the chair, against the wall, just something at home. You don't need to go to a gym. Just do some things at home. You can do your own housework. Encourage someone to do. In COVID, a lot of people had to do their own work right at home. So they realized that they could do it. I mean, although they had never done it before, they could do it. But I don't know how many people have continued doing it even after COVID. They should actually, because the elder people, if they do some work at home on their own, it makes a big difference. Just dusting, a little cleaning, just putting things in place. It involuntarily allows you to walk a little bit. It allows you to have a little diversion from what you're doing. It spends time. It's all quality time. Eventually, it's time. So you'll be spending it in the right way. So do your things at home. Do gardening. If people like gardening, brilliant activity to indulge in for older people. A lot of work, a lot of satisfaction, a lot of exercise, and good for everybody.
Yeah. Uh, Ashok is saying, although not part of my job, recently I got trained in CPR AED online and in person training. I felt I should have done this while I was a student, immensely useful. Dr. Sunilji, should such life saving basic training be made part of the curriculum for all students?
Yeah, it should. I mean, it goes without saying, anything that is life saving should be taught to people, and it should be a part of schooling activity also. I mean, it can be a part of science when they are taught about the human body, or basic sciences. Uh, I mean, can you imagine if everyone knew that, how many lives could be saved? I mean, you don't really, sometimes just the knowledge of CPR is enough, and you may not need a AED machine if you just know how to do a
Yeah.
good CPR. So I'm happy that you've learned CPR and AED. I mean, it will come of use to you at some time or the other, or to some other people. Yeah,
Yeah.
great.
Mode E says, is it true that chickpeas soaked overnight or branched almonds and idli made from urad dal help build muscle far more safely than protein shakes?
I would go for this more than protein shakes any day. I mean, see, they are basically proteins, so you can use them and prepare them in whatever way you want. I too do some of these things, so it will be a good thing. I'm sure it'll help. And any day better than protein shakes. I mean, don't get into that. I don't understand why these youngsters get into. Don't go for shortcuts. It's as simple as that. Don't go for shortcuts. Get into good habits, and just know a little more, be a little educated before you do these kind of things, because um, these are not things. Anything natural is always better than anything artificial, remember that. So just go for natural therapies.
Yeah. Maya says, so balance, awareness, flexibility, muscle strength are important factors. All people should take into account. Learning a new skill set or activity will help.
Absolutely. All this is true. And this is exactly what is needed if you want an older person to remain active and remain independent. If you want any of your family members who are getting old to remain independent for a long time, these are the things that will make a big difference. Balance is the primary thing required for all of us. You cannot, I mean, you can't under exaggerate the importance of balance.
Yeah.
It's very crucial. Yeah.
Shweta says, for vegetarians, it's different to get all nutrients from our daily food. Supplements like calcium, magnesium, zinc, folic acid, iron, are they advisable?
Again, see, when you are you deficient in any of these? If you are deficient in any of these, you can take them, because they're just basically supplements. And as I said, the supplement is needed if your body is deficient. So if you realize, if your doctor or your tests show that you are deficient in any of these things, which you will know, like calcium, for example, the teeth get brittle, your bones get a little brittle, you get pain in your joints, your hair falls. These are typical calcium things. You'll know. So you go and take a test. You feel you're deficient. Your doctor tells you you're deficient. Then you take it. So only if there is a deficiency, please take a supplement. Don't take it thinking that more. If I have more of something, I'm going to be better. That's wrong. So more is not good. More is bad. Enough is enough, and enough is good. So just remember that. Okay,
Very
it's
well
just not
said,
enough.
Doctor. Yeah. Yeah. Renuka says, in India, as soon as you get 50 years, everyone calls you auntie. Just people around you make you feel old.
Yeah, that's true. It's so sad because I go for I take part in the World Masters event. So I run 100-meter races all abroad, all over the world. I've won so many of these races. But you know, I just, if this motivates you, I'll be happy that there is a race in the World Masters for people over 100 years. So you have races of different categories, people over 50, 50 to 55, 55 to 60, 60, 65, right up to 100 plus. So there is a 100-meter race for 100 plus years people. And you have a starting lineup of eight people over 100 running 100 meters. Now, isn't that motivation that at 100 years plus, there are people are still able to run 100 meters? And what's more surprising is that these people don't just come and run, they train for it all year round. So they eat, drink, sleep, train for this kind of an event. So what are we talking about? 50-year-old people being called aunties? I mean, high time you realize that you are young, and it's only as young as
And
you
it's only a
think.
number.
Yeah, you think, I mean, it's all in your mind. So please don't go with age. It has nothing to do, absolutely nothing to do. Your body is an extremely versatile mechanism which can do wonders. It's just that you don't tap the potential of your body.
Yeah.
So learn to understand and listen to your body and respect it. That's all. And you'll be able to do things that you never dreamt you could do.
Yeah.
So forget that 50 years thing. If someone calls you an auntie, you just look at them in an, just ignore them. That's it.
Yeah.
And
Yeah.
do your thing.
Lopa is asking the same question that a few others had asked. Sudden rise of heart attack while gymming, has it any relevance with vaccination? To which doctor has already clarified that he's not vaccine expert, so he wouldn't be able to answer you on that. Again, see, he very clearly told you that, see, you have to take tests before you join a gym so that you can clear off. If you have any disease or something, you can always take care before you join a gym. So doctor is very clear about that fact. Another thing, doctor, see, as you see, work with elders, one very important factor is being positive, because I've seen that a lot of people who are chair ridden, who are who don't walk about as much, they can get rather depressed, and it takes a mighty effort for them to think positive, because they can't walk around, and they miss what they used to do before. So what is your advice to such people?
Okay, so in Golden Hearts we have a lot of people who come to exercise, and a lot of them are on chairs. So they come with either walker or a walking stick, or they are got by somebody. Now the important thing is, if you are debilitated in any way, if you cannot work out like other people do, there are a lot of exercises that can be done on a chair also. Sitting on a chair, you can do plenty of things to strengthen your muscles, to, as I said, make your joints flexibility improve. And also, what I would say is, try to be in company that motivates you. Even going to a class like mine, like Golden Hearts, will motivate you when you see other people of the same kind trying to do things that you thought you could not do. And once you see them doing it, you will begin to realize that you can also do these things. I mean, if you watch even on YouTube or something, you might find exercises, you will find, not might find, you will find exercises which you can do from a chair. You don't really even need to walk too much, or do anything of that sort. So there are ways in which you can keep yourself fit. And if you need a stick, I recommend that walk in your house with your stick or your walker under supervision. If someone, your nephew, niece, or son, daughter is around you, or your help, they can assist you when you're walking. Just make it a habit to walk a little bit in the morning and a little bit in the evening, even with the help of a walker or a stick or anything. Don't think that you can't do it. So that's the whole idea, that it should see, because if you don't do these things, your situation gets worse.
Worse,
It
yes.
doesn't improve. It doesn't improve. So in whatever situation you are, in whatever medical condition you are, you can get better if you do something about it. If you don't do anything about it, you will deteriorate. It's as
Yeah,
simple as that. Okay. Yeah.
yeah. Sadhita says, just joined Minaji. Just a few days back, one of my ex students, aged just 21, suffered a heart attack while playing football on ground. He was a very sporty kind. Any reasons?
Yeah, now this is a reason that this it can happen. See, as I said, when you exert, anything can happen. After all, it is something abnormal happening to your body. Even if he was a regular player, there are certain conditions in the heart which go undiagnosed. Now, a boy who's 21 years old may never really have gone to a cardiologist or a doctor with any complaint. So it might be an underlying undetected issue of the heart, like a valve disease or something like that, which can be triggered off when the heart is exerted. So the suggestion is that however young or old you are, it may be a good idea to get one medical evaluation done, even if you don't really have any complaints, just so
Yeah,
that you know where your base health is. All the basic things have to be clarified before
yeah,
you exert. Yeah,
yeah.
it could happen.
Yeah. Munmun is asking, can people with heart blockage exercise? If so, what should it be? Also, is it advisable for people with stent in the heart exercise? If so, what is permissible?
Yeah. So, see, heart people with heart blockage, I mean, what are they going to do about it? Now, see, all of us now try to understand this. This blockage business, is become a very commercial thing. Now, I'm talking as a common man, not as a doctor here. When you talk about blockages, people get scared by the word itself, that there is a blockage. Okay, ever since you're born, the process of blockage starts in the body for everyone, because this thing called plaque, which is atherosclerosis, that happens, starts when you're a child. So the artery of the heart, which is maybe this thick, it starts getting slowly, the wall of that artery starts getting filled or stuck by this thing called plaque. So the blockage begins at that time. Now, how much the blockage is at a given age is what is important. Now, if I'm 62 years old and I go to the doctor and he tells me, you have blockages in your heart which are 30% heart is blocked. Now, that is something normal for a 60-year-old person. I shouldn't get scared. Now, if you are talking about a blockage which is serious, which is say 90% or 80%, then you should not be exercising unless you take care of that with, say, a bypass or with stents or something. Now after you put the stent, if you feel better, that is, if your breathing is better, if you can walk more, if you can climb steps without going out of breath, then you can, under supervision of your doctor and knowledge of your doctor, you can start exercising gradually by first walking. My suggestion would be always to start walking. Don't do anything more vigorous. Start slow walking and increase it gradually, either the time or the speed of your walk, and then take it from there, step by step by step by step. That's how you should do. Stents does not mean no exercise. Stent means exercise. If you don't exercise with a stent, the blockage will happen again. Understand one thing: when you exercise, the blood is being pushed through your arteries. So when the blood gushes, it doesn't allow the plaque to stick to the wall. If
Yeah.
you don't exercise, the plaque will stick to the wall, so the atherosclerosis process increases faster. Exercising is good at any time, any stage, under supervision and under medical advice.
Yeah.
Okay, so
Yeah.
don't worry about that.
So just one last question before we close the session. It's been so interesting, and Doctor has been so, I mean, explaining things in such a simple manner for all of us to understand. Thank you so much for that, Doctor. So one last question comes from Mode E. My father is 72 and he still does weightlifting. I've asked him multiple times to stop, but he has far too much energy for his age. I'm worried that his above normal BP is going to hurt him.
Above normal BP. Okay, he's 72. Okay. You should actually, what's his name? Who's asking this question? I'm sorry.
Modi.
Modi. Modi, I, I mean, to tell you the truth, I don't know, but you should get some of his energy, because seriously, at 72, if he's doing weightlifting, my grandfather was 93 and he used to do weights. Okay. And, I still have his weights, the weights that he used, the old fashioned, not these kind of dumbbells that you now get. I have those old fashioned. But I could have shown it to you. They're right here, but I use them now. If he's 72, he's doing weightlifting. Please don't stop him. Uh, Let him do it, because see, remember one thing, Modi. That is what gives him happiness. That is what gives him pleasure. That is what he has been doing. He is now. He's acclimatized to that. He's enjoying it. So why would one want to take away that enjoyment? And see, his heart and all that, with his BP also, his heart must have by now acclimatized. It is like, it must, his constitution is set. So try not to disturb his constitution. Let him do what he's doing. In fact, get a little bit of what he's doing, and all of you should do that. I mean,
Yeah.
these are the things that drive these people. They're very difficult to get these kind of people nowadays. The youngsters are overdoing a lot of things, and they don't really know what they're doing. They just do it because others do it. But
Yeah.
it's people like this who you understand their body.
Yeah.
So Modi, you're lucky. Don't worry.
So everybody is thanking you for the wonderful session, Dr. Sunil. I hope you would be able to join us in further sessions like this, where you could clarify a lot of the doubts that people have in today's age.
It's
So
been
thank you
wonderful.
so much.
It's been wonderful. Let me wish all of you a great new year this time, 23. And Meena, thank you so much for having me. I enjoyed the session a
Yeah.
lot.
Good
Thank
night
you.
and Jai Hind.
Jai Hind. Good night. Namaste. Thank you.